Hi, my name is Eppie. I'm a nurse practitioner at Moffitt Cancer Center in Tampa, Florida. Thank you for joining us for this symposium today. I'm going to discuss what are typical and things to expect whenever you have surgery on your kidney. So we'll move through this PowerPoint presentation. There'll be a question and answer session afterwards. One of my colleagues, Lillian Gonzalez, will be the lead for that. So the objectives of this is really post-surgery recovery expectations. You'll learn what's normal, what's common, ways to improve your recovery, when you can go back to work, really what the recommendations are for that, and when you should be more concerned to reach out to your physician or to call 911. Although ablation's not in the OR surgery, it's still treatment. So I wanted to just briefly cover this for people that choose to have a kidney cancer or renal lesion treated with ablation. Ablation is where a needle is put in through the skin to either freeze or heat destroy the tumor. About 95% of people that have this done really don't feel any pain, have some muscle soreness at the site, and are usually told to take it easy for a couple days, and that'll be directed by the interventional radiologist that does the procedure. There will be some people that have a little bit of blood in the urine. That should resolve after a few days. And again, it should just be a little bit of blood. Complications to worry about are a hemorrhage or arterial pseudoaneurysm. You will see a lot of blood in the urine, not a little bit, a lot. Blood in the toilet. You could have some pain with it. This would be a reason to reach out to the interventional radiologist or to go to the local ER for further treatment. And again, this would be a large amount of blood. Even if it stops and comes back, that's kind of the thing to watch for. And again, this is not a common occurrence that happens. So now we're going to talk about treatment with surgery. So surgical intervention is done in the operating room under general anesthesia. There's usually 3 types that are done to treat kidney cancer that's been confirmed by biopsy or a kidney tumor that is suspicious for cancer. So an open incision is done where there's actually a cut that's made into the skin to gain access to that area. And then the tumor is removed. This is again done by your doctor in the operating room. The skin is usually closed with glue, but sometimes can be so closed with surgical staples. Those decisions are, of course, made at the time of the surgery. Another way to treat this is a laparoscopic procedure. This allows for smaller incisions, and a camera is used to aid in the removal of the tumor. These little laparoscopic openings are usually closed with surgical glue as well. And then robotic is the next thing that can be done. Robotic surgery, again, has small incisions in the abdomen, and there are surgical tools that are placed in these openings as well as a camera. And those tools are actually what's used to guide the surgeon to remove the tumor within the kidney or the kidney itself. There's also a console, and the console is used to watch what the camera is doing and operate these tools. If you kind of think about kind of a video game element, where the console is the driver and that's what's used to manipulate the tools. And again, this procedure is often closed with surgical glue. So really what to expect with surgery, a partial nephrectomy or a total nephrectomy, that's removing the whole kidney. You're usually in the hospital overnight, could stay a day or two. They're going to make sure that you're safe for discharge, and that again is up to your physician that's doing the surgery. You're likely to have a drain placed in the abdomen after surgery. That fluid is usually checked the next day just to make sure everything appears to be within normal ranges, and then that usually gets removed prior to going home after your surgery. You should be sent home with post-operative instructions and any prescriptions that you need, usually pain medication, maybe some stool softener, and those things will be discussed with you at your discharge, what you should take and how you should take them. And again, you should be given some post-discharge paper instructions to review. So surgical pain is a big question that patients have. Robotic surgery, people usually recover a little bit quicker. Usually robotic, if you think about it, the surgical pain might last about 1 to 2 weeks with soreness for about 2 to 5 weeks. And that's kind of on the long end of it. I often have patients that have robotic surgeries. They come back in for their post-op and they say, hey, I didn't even take pain meds when I went home. I was a little uncomfortable, but not in pain. So again, this is managed with prescription pain medicine at discharge, or they could have you transition to over-the-counter Tylenol. Open surgery, pain usually lasts a little bit longer. So that can be anywhere from 3 to 4 weeks with soreness for 3 to 7 weeks. Again, managed with pain medication, over-the-counter Tylenol. If you're on narcotics, they usually recommend you to take some stool softeners. This is going to help to avoid constipation. Normally, they don't have you take any NSAIDs. Those can be aspirin or Motrin, Aleve, ibuprofen. I think what's another one, I can't think of the other name. But they don't want you to take those because those can be a little bit higher risk for bleed, and they cause the kidney to have to work a little bit harder. So your doctor would advise you what they would recommend you to take. So what to expect after surgery? Your kidneys, their job is to filter toxins from your bloodstream and make waste, which is urine. So you'll have your kidney function monitored with repeat lab work, normally done while you're in the hospital and then again done at post-charge. We want to make sure if you now have had one kidney removed that the remaining kidney is able to pick up the pace and do its job. And if you've had a partial nephrectomy, we want to make sure that the kidneys are kind of back to working over a period of time back to your baseline creatinine or as close to that as we can get. Very, very fatiguing surgery. That's the biggest complaint I have from patients is they really didn't realize it was going to be so fatiguing and they were going to get so tired. This is very, very normal. Again, your kidney's job is to filter your blood, pull toxins and make waste. So whenever we've done surgery to one of the kidneys or removed a kidney, it's going to be really tiring for your body because it's still doing that job no matter the fact that we've done surgery. So I always tell people, try to take a few walks daily. Don't walk a long way, don't push yourself, and rest. If you need take a little nap the first week or two after surgery, that's okay. Listen to your body, but you want to get up and you want to move and take some small walks, but listen to your body and just rest if you need to. I always tell people every week, try to increase your walking distance a little bit. Again, you don't want to overdo it or push yourself because that'll pretty much set you back a little bit with that fatigue. You want to make sure you drink plenty of water. Water really helps your kidneys to filter well, so you want to drink plenty of water after surgery. About 75 ounces is, pretty much what's recommended, but if you need directions from your physician, of course, ask at discharge. So things to expect after surgery, again, avoid lifting. We really recommend over 10 pounds for about 6 weeks, and that's about equivalent to about a gallon of milk. That gives you kind of an idea on what to lift and that limit. We don't want you to do any strenuous activity. This would mean getting on your exercise bike or brisk walking around the neighborhood or getting on that treadmill and really getting your heart rate up. So we want to avoid any strenuous activity for about that 6-week recovery time frame. After about 6 weeks, you should be getting back into your old routine. I always tell my patients, if you try to do something and it kind of bothers you, wait another week and try it again. And we tell people that really about 3 months, they're back at their baseline prior to surgery. If you're closed with surgical glue, that glue can take a while to come off. It can really be stuck on there. We don't want you to pull it or try to speed up taking it off. Take showers. You can take some soap with your hand and kind of wash on that. We don't want you to scrub it. So that glue kind of helps the scab underneath heal, and it should start lifting on its own. We tell people you can trim it if it's bugging you or getting caught on your clothes. If you're closed with surgical staples, then those usually get removed at your post-op visit. You'll have your incision assessed, those staples get removed, and they might put these little white steri strips on, and then those will fall off on their own over time. Again, we always tell people take showers until you have a scar. So basically all the glue and the scabs are gone and you have a closed system. After that time, then you can usually submerge in a bathtub. A lot of people ask, what should I eat? I had one of my kidneys removed. What should I eat? We always tell people a heart healthy diet. You want to eat fruits and vegetables. If there's some restrictions based on you have some elevated creatinine, which is your renal function before surgery, and it kind of worsened after surgery, they may give you some other restrictions to avoid salt or things like that. But usually we tell people a heart healthy diet should be fine after surgery. You want to eat plenty of fiber. That's going to help you avoid constipation, which would be pretty uncomfortable to get after you've had your abdomen worked on. So we always want people to really avoid constipation. So either stool softeners like we talked about before, or eating, fiber in their diet. Always reduce salt intake. That's part of the heart healthy diet. And sometimes eating small meals often rather than large meals after surgery, because your belly's kind of sore. And if you eat a whole bunch and you get bloated, it might be pretty uncomfortable. So sometimes we recommend people just to eat small meals throughout the day. It might be a little bit easier to digest and tolerate while you're recovering from surgery. A lot of people ask when I can go back to work. You know, having cancer can be a financial burden, and some people can't afford to be off work very long. So really depends on what you do. And if you've had an open procedure or if you've had a robotic procedure. So I have patients that come in that sit behind a desk. They don't do any heavy lifting. They don't do any strenuous exercise, and they want to get back to work. And I tell them that should be fine about, you know, after week 2 to week 3, just take it easy. So teaching, working at a desk, retail, you may get kind of tired and fatigued if you have to stand a lot. People that have jobs where they have heavy lifting, they're a police officer and have to wear a big gun belt, or they work as an electrician and they have to carry around a big tool box, or a plumber, construction worker. So usually those people we recommend to take off the full 6 weeks. Some of them are off a little bit longer than that. And again, your physician that does your surgery can work with you on work releases. If they say, hey, you can go back to work, but let's do some restrictions. So maybe your boss will let you come back, but avoid certain activities. So you can, again, talk to your physician about when they recommend you going back to work based on the type of work you did and how involved your surgery was. Another common thing that happens that men often complain about is they say, man, I'm having some testicular pain and I didn't know I was going to have that. So that's usually when you have your left kidney operated on, there's some drainage from the gonadal vein. That's a kind of a vein that drops down, and men will feel discomfort in that left testes. That is normal. That can happen after surgery. Don't be alarmed. Sometimes men aren't aware of this and aren't told. And so that's usually one of the #1 reasons men call in after they have kidney surgery on the left side is for that testicular pain. Also, shoulder pain. If there's laparoscopic procedure, robotic laparoscopic, and the gas is used, that can actually cause some pain in the shoulder pain. And it's really from the diaphragm changes from the gas. So some people aren't made aware of this. Again, those are calls from that the nurses get. People are complaining of shoulder pain after surgery. That usually just lasts a few days after you go home, and then it will resolve. So here's a good question. People say, hey, I've had one kidney, or I had part of my kidney. How do I take care of things? So some people have normal kidney function. That means that lab work we talked about, that creatinine. And your primary care doctor can just watch your labs with your routine lab work every year. But some people might have an elevated creatinine, so that renal function isn't quite as good as it should be. And they might be referred to a nephrologist, and a nephrologist is a doctor that manages the health of your kidney or your kidneys. Of course, drink plenty of water. Your kidney's role is to filter out toxins. So when you give it water, that's how you change your filter system, so to speak. So make sure you drink plenty of water. If you have diabetes, diabetes kind of makes the blood sticky, if you want to think about it that way. So having your blood sugars managed, keeping them in a good range will really help the kidney process the blood as its job is without having that kind of that sticky blood going through it. So it's really important if you have diabetes or elevated blood sugars to kind of really keep those managed well. Another good thing is managing your blood pressure. So whenever you have elevated blood pressure, that's a higher pressure that's going through the kidneys. And over time, that can cause some stress and damage to them. So you want to really manage your blood pressure, whether you have to take medication or you lose weight to help manage it. It's really important to keep a really good close management of that blood pressure. And another thing, if you're taking medications or supplements, some of those things can cause your kidneys to work harder. Your primary care doctor can talk to you about any medications that might be harder on your kidney. And sometimes there's an alternative drug they can change to that's more protective of the kidney. So when you've had a kidney removed, talk to your primary care doctor about any medications you're taking. If you're somebody that has, say, back pain or knee pain, and you take a lot of Motrin or Aleve, over time that can cause some damage to the kidney or some worsening of the kidney function. So you want to make sure that you let your doctor know what type of medications you're taking or supplements, because there are some, even though they're a supplement, they could actually cause your kidney to work harder because the kidney's having to filter that out. So always let your doctor know if you're taking anything over the counter, any medications, discuss things that can be switched just to help protect that kidney function over time. And some concerning symptoms as we kind of get to the end of this presentation, we kind of talk about those things that are common, expected. Well, there can be some concerning symptoms, and those are when you're going to want to reach out to your physician. If you have any increased redness or drainage from your incision site, that might show that there's a little infection going on. Blood in the urine that's not just, first few days seems to resolve, but, a lot of blood in the urine, you'd want to call in. Fevers of 100.5 or greater, again, that's probably going to be in your discharge paperwork. recommending you when to call when you have a fever. Whenever you have any shortness of breath, that would mean you're sitting down, you're trying to relax, and you just cannot get your breath, you're having some trouble. That would be a reason to call 911, or if go to the local ER. Change in mental status. Somebody had their kidney removed, they've been sitting on the couch doing fine. Now 3 days later, they seem to be lethargic. Somebody can't, have a conversation with them. They seem to not be able to communicate well. That would be a reason to call 911. And then severe pain. This isn't your post-surgical pain where you're like, oh, this is a little uncomfortable. Oh, it hurts to bend over, load something in the dishwasher. This would be some severe pain, different than you've been having altogether. You can't get it to resolve, or it continues to get worse. That would be a reason to either call 911 or reach out to your physician. And ancillary support. I had another presentation where we talked about this. Through your cancer journey, there's a lot of other support services, social workers, palliative care. Acupuncture is really good to help with pain, that some people have large lesions, and whenever they get those removed, they seem to have a lot of discomfort in those areas. Massage therapy is really good to help relax and, kind of can work through some of those areas. And just like the, Judy Nicholson Kidney Cancer Foundation, those are community support resources. So there's always going to be something in your area. Either you can Google and find it, or your local physician might have some resources they can direct you to. So that's my presentation. Again, my colleague, Lillian Gonzalez, is going to do the question and answer session for you. She's also Spanish speaking. So if we have any Spanish speaking patients that would like to ask questions, she's going to be able to answer those for you. So thank you very much and have a great day. Bye.